So I was curious when you looked at the evidence associated with the different modalities of training. I didn't see simulation or use of gaming theory there.
Yeah, if we're looking at competence, those would fall within the intervention strategies that would fit there. Now, I can't say that I have seen in a systematic review those gaming strategies separated out. And what was the other one? Simulation?
Yes, simulation.
Oh yeah, no, simulation, of course. I mean, we use simulation quite regularly. The challenges there are, again, those transitions and finding if we choose randomized controlled trials as the greatest level of science for making decisions, they're not ordinarily available. There's evidence building. I think Don, if you have any, Don Moore is here. If you have any information that might add to that, it would be helpful. Around simulation or gaming as good quality evidence.
Well, I think the people like Emil Petrusha and Barry Eisenberg have done studies that shown that simulation is effective in changing behavior.
Ordinarily, they're under controlled conditions. The gold here is whether those behaviors transfer into the next level, which would be in an uncontrolled situation in practice. So I hope I've addressed that. That's the best I have for now. Anyone else? Stuart?
There, I got it. Thanks. So you said earlier, Paul, that people don't learn unless they're motivated to do it, and so this needs assessment's an essential element. But how do we reconcile the performance improvements through education versus performance improvement through system transformation, where the context in which people work change so it's not a volitional issue?
I think the short answer to that is we have to explore both avenues. And the tools that I mentioned about psychological safety, shared mental models, that kind of information and those data sources now help to make those gaps more visible and the opportunities for change more proximal, I think. So we're looking at our table, the ecology of change was one of the terms that came up. Anyone else? Questions? Okay. So this is the time, I think, can we move to the next slide? It's quite compelling. Who benefits from the CPD design? How do they benefit? And what is the cost? And so I think we have 10 minutes to build on your prior program, try to identify these, and be ready to report back from your table. Thank you.